Let's call the meeting to order. Roll call and certification of quorum. Can you all hear me?
Yes, sir. I'm going to be doing the roll call. Dr. Manuel Gonzalez,
Okay.
Carrie Hatley,
Here?
Eric Garcia. Oh, where did he go? Sir, you're muted.
I'm on. I'm back on. Sorry.
Dr. Richard Schramm,
Here.
Blaine Sybil,
Here.
Maurice Termite Watkins,
Now I'm muted.
Keith Underwood, Mr. Underwood, go ahead and turn your camera on and mute yourself.
I'm here. I'm here.
Thank you. And Dr. Louis Chapa.
Here.
So we have a quorum.
Do we have a quorum?
Yes, sir.
Okay, let's go to C. Advisory Committee meeting training.
Good morning,
There's a video
everyone.
conference meeting.
Yes. Hi, Mary Winston here, TDLR. Thank you for everyone's patience this morning. I tell you, we can do everything humanly possible, and then we just have to wait on our technology. Being conducted by video conference. The public is watching live stream, and persons who signed up to make public comment will have a chance to do so later in the meeting. The meeting is being recorded and will be available on our YouTube channel. Here are some tips to make sure we have a successful meeting. Please keep your microphones muted until you'd like to speak. Please put all phones on silent and turn off any other sources of noise in your workspace. Please avoid moving, fidgeting, because it draws the camera to you or drops the eyes to you and away from what's being presented. State your name before you begin to speak, and raise your hand if you'd like to speak. State your name, raise your hand, and the presiding officer will make sure that he calls on you. If you have any problems connecting during the meeting, try to let the presiding officer know. As you can see, sometimes we do have a couple of technology blips, and we have staff working in the background to assist with these connectivity issues. Please stay on camera during the meeting, even if you aren't speaking. And if you need a recess, let the presiding officer know by raising your hand visibly on the camera and stating your name. Welcome, Dr. Lee. We're so glad you were able to get connected today. If you get inadvertently disconnected from the meeting, please rejoin the meeting using the same link you used to join the meeting. And here's one that I have to add for safety's sake. Please, if driving during the meeting, please pull over, stop. We want you to attend this meeting and many more, and we don't want anything to happen to you from inadvertent attention drawn from this meeting. May not be too exciting, but it's very informative. We thank you for being here. We want your attention, but most of all, we want your safety. We've conducted several of these meetings lately, and using this medium, we know a few awkward moments, minor blips. This morning, we had to start a little late. That's okay. We'll deal with them in real time, and we'll take a small recess if we need to. We'll adjust, we'll get through every meeting item, and we'll take care of everything we need to act on. So we want to thank everyone for participating this morning. And Anna, I think I forgot to say this, we'll be conducting roll call votes on any action that needs to be taken. This will assist us in not having a bunch of folks speaking at once and us being able to keep meeting notes and take minutes. Thank you so much, and we appreciate you being here today. Presiding Officer Lee, we have now, and thank you, Dr. Gonzalez, for pinch hitting for us, but we've just gone through agenda item C, and now we are at agenda item D, just to catch us all up on the same page. You are muted, sir.
Morning. Let's move on to agenda item D, and I'm trying to see if I can get that up on my screen. Anna?
Yes, Dr. Lee.
Training for advisory board members for the Open Meetings Act, Public Information Act, and Administrative Procedures Act. Doug Jennings will be presenting on this item.
Thank you, Anna, and thank you, Dr. Lee. Chairman, board members, I've gotten the opportunity to work with some of you before, but some not. My name is Doug Jennings. I'm Assistant General Counsel for the department. I am the lead General Counsel attorney for this program. As of a few months ago, Colleen Tran, your former board attorney, has changed positions, has changed agencies. And so I've gotten the opportunity to work with the staff and some of the members in the last few months as we get into COVID protocols and reopening. And it's really been it's been kind of a trial by fire, but it's been a great experience. Just to give you a quick background, I've been with TDLR for almost 5 years now. Been practicing nearly 15. So not new to the game, and I look forward to working with you in the coming months and years. We're going to right now give you the your annual certification training on the Open Meetings Act, Administrative Procedure Act, and Public Information Act. I will try to make this brief, and I'll have a moment for questions at the end. But if there's something that I say that you don't understand, feel free to pipe up and ask a question. I'll be happy to clarify it for you. Going to share my screen now. There we go. Is that coming up, Anna? Okay, thank you. As I said, we'll be giving an overview of the Open Meetings Act, the Administrative Procedure Act, and the Public Information Act. We'll spend the majority of our time here this morning with the Open Meetings Act, since that's most relevant to what you do at any given board meeting. As I'm sure you've known before, the purpose of the Open Meetings Act is to ensure open and transparent government, and the act requires meetings of governmental bodies, such as yourself, to be open to the public and to be preceded by public notice of the time, place, and subject matter of the meeting. We will need to talk about a few key terms as we begin this discussion. The first key concept is a quorum. A quorum simply means a majority of the members of the advisory board. In this case, a quorum of your board is 5. You have 9 members. A quorum of the board must be present in order to take official action. And if a quorum is not present, the board may certainly meet to discuss, but may not take any official action. Another key component of the Open Meetings Act is deliberation. Deliberation simply means discussion about a topic that's within the board's subject matter. A meeting is a little bit of an interesting term. A meeting under the Open Meetings Act is something that occurs anytime and anywhere a quorum of the advisory board engages in deliberation or discussion about public business or public policy over which the board has control. And the last key term is notice. The Act requires advance written notice of any meeting. It requires notice of the date, time, place, and all the subjects to be spoken about at that meeting. TDLR provides notice in the form of an agenda, which you have before you, I'm certain. And also we must file that agenda in advance with the Secretary of State. Just another note about an agenda. The board is limited to speaking about the topics that are presented on the agenda. If you find yourself going too far afield, you'll see me raise my hand and ask you to move a little bit closer to the agenda item. I mentioned a minute ago that a meeting occurs anytime and anywhere a quorum of the board engages in deliberation about board business. Well, we know that obviously we're in a public meeting today that's been properly noticed. But what if you find yourself along with a quorum of board members at a social function, at a convention? These things can happen and often do. Can you ever meet in that sort of informal setting without violating the Open Meetings Act? And the answer is yes. Even if you find yourself at a convention or workshop with a quorum of members, just keep in mind that that gathering will be subject to the Open Meetings Act if a quorum of members discusses board business. However, if you restrain yourself and you keep yourselves from speaking about board-specific business, you may absolutely engage in that discussion. One of the examples I like to mention is if you're at a workshop and you find yourself with a quorum of members, and there's some discussion about a topic that was presented at the at the workshop that doesn't necessarily involve what you're working on with the board, you can certainly talk about that. Or if you're talking about incidental matters, such as who's attending the reception, certainly fine. You don't have to be afraid of being near a quorum of members in that setting, but you do need to be aware of your surroundings. So some key points to remember: just always be aware of any situation occurring outside a noticed meeting in which there's a quorum of members present, and don't engage in substantive conversations about board business when a quorum is present and you're outside of a regularly scheduled and noticed meeting. One other key point to remember is to beware the walking quorum. Walking quorum is not as scary as it sounds, but it's something to be, again, aware of. A walking quorum occurs when fewer members than a quorum engage in a discussion about board business, and then they transmit or communicate those discussions to other members. So a good example of this is, let's say that there is a 5-member advisory board, 2 members in their spare time exchange phone calls and emails about an upcoming rule change. They swap some opinions and some research on that issue just between themselves. Then one of those members forwards that email exchange to another member. So now what we have is, while the initial communication just involved 2 members, which wasn't a quorum, we've now spread that communication to a third, which constitutes a quorum in this example. And so you are now you're engaging in discussion with a quorum outside of a properly noticed meeting. Bad news. This can also happen, walking quorum can also happen on social media. Again, I'm not terribly proficient in Twitter, but I'll give a little example involving that. So let's say that we have Chairman Doe of our of an electrical advisory board, let's say. Chairman Doe tweets a link to an online news article about a big issue facing the electrical industry. Another board member, Smith, sees that link and retweets or shares it. And along with that share, makes a comment saying it's vital that the board take up consideration of that issue. Board member Jones then comments on Smith's post, states, "We really need to look at Rule 101." At which point, board member Williams comments on Smith's post with a comment, "I agree, let's get this done." And lastly, we see board member Johnson weigh in by giving Smith's post a thumbs up. So you can see that Chairman Doe initially may have had no idea that his post was going to end up involving a quorum of members. But after board member Smith shares that, we see that at least 5 members of let's just say a hypothetical 9-member advisory board, 5 members have now engaged in some discussion online about board business. So you can see how that might be a little less obvious. So I would suggest some good practices. We'll just talk about that first one. If you're going to create posts on social media about board business, if there's a likelihood that a quorum of members could participate in those discussions, probably don't post it, or at least be very wary, and maybe instruct board members not to participate in that discussion. Also, to avoid a walking quorum, don't meet in small groups such as work groups, and then communicate those discussions to other members. Particularly in the case of work groups, we make those work groups less than a quorum, so those groups can have their discussions without a properly noticed meeting. The time for those groups to make their reports is, of course, at a properly noticed meeting, such as today. Also, be wary of sending emails or text messages to a quorum of members regarding official business. Switching gears a little bit, let's talk about our guidelines for open sessions. Today is an open meeting, an open session. You are limited to discussing the specific items on the agenda. Also, at some point, there will be a public comment period at which members of the public will be given an opportunity to speak, and the presiding officer can set reasonable limits on commenters. We usually have a 3 or 4 minute time limit, for example. If you have an idea for an agenda item, something that's not on today's agenda, make a proposal at the end of the meeting to add that item to the agenda for a future meeting. That way, we can broach the topic and delve in a little more into detail at the next meeting. Just a reminder, there are penalties and remedies for Open Meetings Act violations. First thing is a civil remedy. Any act that is taken in violation of the Open Meetings Act may be voided by an interested person, including the media. Probably a little bit scarier are the criminal penalties. Circumventing the Open Meetings Act can result in penalties of a fine of up to $500, and could also potentially involve confinement in county jail for 1 to 6 months, or both a fine and jail time. So these are serious violations. We take transparency and openness very seriously in Texas. Moving on to the Administrative Procedure Act. That act establishes minimum standards of uniform practice and procedure for state agencies, and including governing our contested case processes where our enforcement division pursues sanctions or administrative penalties against licensees or other persons. The APA also governs the rulemaking process. A rule, as I'm sure you know, is a statement made by a state agency that implements or interprets law or policy. The most common model for us is that there is a statute or set of statutes that creates and regulates the subject matter of a board. For example, combative sports. We know we have statutes that regulate that program, at which point TDLR enacts rules to clarify, interpret, and fill in the gaps for those statutes. So we use both sets of laws, rules, and statutes to enforce the program laws. There are many sources of rulemaking. For example, when new legislation passes that may require rulemaking, often requires rulemaking. Rule suggestions can come from board work groups, just general board discussion in a meeting like today, often come from ideas from TDLR staff. We are required to review program rules every 4 years, and during those opportunities, we may see some areas for improvement. And also, there's a mechanism called a rule petition, by which a member of the public, can request a rule change. Here is just a flow chart of our rulemaking process here at TDLR. I won't go through every square in detail, but I'll say, for example, there's an idea for a rule. Staff will develop that rule and come up with a draft, at which point the draft is sent to the advisory board for what we call the first look. If the advisory board decides that rule at their first meeting is something that they'd like to move forward with, they will recommend publication of the rule, at which point the agency files the rule with a publication called the Texas Register, which is maintained by the Texas Secretary of State. That proposed rule is then published, and the public has 30 days to submit comments to the agency to help us evaluate that rule proposal. Once we filter through those comments, we will bring them to you in a second meeting. So we will present the proposed rule and all the comments received to you, at which point the board, if the board wants to continue and wants to continue pursuing this rule, will make a recommendation that TDLR's governing body, our commission, adopt that rule. Then our commission will have a separate meeting, look at the rules and comments and your board's suggestion, and determine whether or not to adopt that rule. If the commission votes to adopt the rule, again, the text is filed in the Texas Register, and the rules become effective 20 days after that filing. And lastly, we'll talk about the Public Information Act. You've heard this referred to probably as the Open Records Act. It's the set of laws that allows citizens information about the affairs of government and the official acts of public officials and employees. And what it does is pretty important. It makes all documents, records, and other information relating to official state business open to the public, with some exceptions. Now, public information includes both physical documents maintained or created by the agency, and also any electronic communication created, transmitted, received, or maintained on any device in connection with official business. So one of the things you'll hear us harp on at TDLR is if you, as a board member, are engaging in board business and you're using a phone, you're using a laptop, a tablet, and you are conducting board business through that, your emails or text messages that you're using, that you're sending on that device, may be subject to disclosure under the Public Information Act. So if our agency receives a request for, let's just say, any and all emails or text messages related to a certain rulemaking, we will internally look at our records, but we will also send out an email to you, board members, to ask if you have any records on your devices relating to that request, and you must disclose those. However, there are some exceptions. So if you'll see at the bottom of this slide, just some example exceptions. If you have things in those communications like your date of birth or personal email address, or things like protected health information, our open records attorney will look through those messages and redact or just will not disclose those items. Very importantly, if you receive something that looks like a request from a member of the public or even from TDLR, asking you for information that you may have on a device or your email, for example, on any particular topic. Well, first, if it's from the Office of General Counsel or if it's from TDLR, please respond very quickly. We are on a strict timeline for processing those requests. And very importantly, if you receive a request like that from a member of the public, please forward it to me or to open.records@tdlr.texas.gov as soon as humanly possible. And the reason is because we have 10 days to respond to these requests. And if we don't respond in a timely manner, we may end up having to disclose information that otherwise would be protected from disclosure. So just a little reminder there, if you get those requests, please take them very seriously. They mean a lot and they matter a lot. I know that was a whirlwind tour through Open Meetings Act, Administrative Procedure Act, Open Records. Does anyone have any questions that I can help with?
I have a question. So would it make sense to create board emails via something like G Suite separate from using personal emails based on your last comment?
Yes, absolutely it would. In fact, I think that's the cleanest way to do it. And Anna may be able to weigh in, but that certainly would make it easier to separate your personal business from your official state business. And that is where things can get tricky. And so that's certainly a best practice, yes.
Okay, thanks.
Okay, thanks a lot, Doug.
Thank you.
We're on agenda E, which is the approval of minutes. I'll give everyone a chance to pull it up and go over it. And if everyone has, we will make a motion to approve the minutes.
Aye.
I would ask for a second.
I'll second it.
I was recognized Mr. Hatley. And then we'll ask Anna to do a roll call to roll call the vote.
Sir, can we get who made the motion first?
Motion was made by Dr. Gonzalez. The second was made by Mr. Hatley.
Thank you. Okay, I'm going to do a roll call vote. Dr. Gonzalez? Carrie Hatley? Eric Garcia? Dr. Richard Schramm? Blaine Sybil?
Here.
Keith Underwood? And Dr. Louis Chapa?
Here.
Sir, the motion passes. I'm sorry, sir, you're muted.
Motion passed. If there are no other questions to the review of the last minutes, then we'll move to item G. I'm sorry, item F, which is public comment.
Sir, we have one public comment today. We didn't have any via email, but we do have one person who wishes to speak during the meeting. His name is Michael Corley. He should be on momentarily. Oh, there he is. Mr. Corley, you will have 3 minutes to speak. Go ahead, sir.
Good morning, good afternoon. My name is Michael Corley. I'm the president of the United States Muay Thai Federation, a 501c3 nonprofit, IFMA executive board member, and combative sports gym owner in Houston, Texas. The United States Muay Thai Federation is the official United States National Federation member of the International Federation of Muay Thai Amateur. In December of 2016, Muay Thai was approved by the International Olympic Committee Executive Board as a provisional Olympic sport, and IFMA and IOC recognized international federation. IFMA is now a proud member of the Association of International Sports Federations. IFMA is the world governing body for the sport of Muay Thai. They follow very detailed rules and regulations for their tournaments and events. These rules protect our youth with limited contact by age. With the IOC recognition, we, as the United States Muay Thai Federation, ask that we can carry out IFMA amateur Muay Thai tournaments and events in Texas to develop athletes for potential Olympic competition and the upcoming World Games 2022 in Birmingham, Alabama. Currently, there is no regulation in the state of Texas for youth Muay Thai, and illegal smoker events have been carried out almost every weekend, many charging for tickets, awarding championship belts, and lastly, having knockouts without proper medical supervision on site. I have sent letters from the International Olympic Committee, from IFMA, about our recognition and USMF's role in Muay Thai to TDLR Executive Director Brian Francis and Combative Sports Division's Greg Alvarez in February 2017 with no response. On September 4th, 2019, myself and TDLR official Joshua Ferraro drove to TDLR headquarters for a meeting with Jim Erickson and Greg Alvarez to discuss Muay Thai in the state of Texas. It was at this meeting that we presented the IFMA rules and regulations, discussed the outbreak of illegal Muay Thai and MMA events, and lastly, the need for Texas to catch up with the rest of the country and allow a third-party organization for the regulation of Muay Thai in the state. Since that date, a little over a year ago, we have not followed up on anything. Currently, New York, California, Florida, Oklahoma, Arizona, and many, many more states allow for not just one, but many third-party amateur associations to carry out Muay Thai tournaments and events in their states. Why is Texas not allowing this? Why is Texas not allowing our youth to participate in an Olympic recognized sport? Why is Texas turning a blind eye to illegal combative sporting events? There's nothing in our combative sports law that addresses youth combat, yet we're told Muay Thai is forbidden. As a Texan, I want better. I want Texans represented on the USA team at the 2022 World Games in Birmingham, Alabama. I want Texans, most importantly, to have a safe and healthy environment for our youth to get experience. Thank you.
Thank you, Mr. Corley, for your presentation. The normal procedure is that your presentation is listened to by the board, and then we discuss what needs to be done in terms of discussion, or either having it presented to one of the committee groups so that we can get back with you in terms of a reply.
Thank you.
Okay. We're going to move to, thank you, Mr. Corley. We'll move to item G, which is staff reports. And we'll first call on Coley Wallen. Am I pronouncing that correctly?
Waylon.
I'm sorry.
You're okay, Dr. Lee. Good morning, Presiding Officer Dr. Lee and board members. It's so good to see you, and I hope that everyone is being safe during this time. So to start my report, I'll start with our personnel updates. We've had an employee who resigned from TDLR and went on a new journey with a new agency. And so we are just grateful that she stopped this way and is grateful for her being here with us. The licensing division has been working diligently since we have been in this place of COVID-19 during the pandemic, and have been working from home, processing and reviewing applications with the great help of our IT department to help us make that happen. We've also have staff that come in daily to the office. We also have employees who are working on a rotating schedule, as well as managers working on a rotating schedule coming into the office. And we've also had an opportunity to cross-train across the agency to help with heavy workloads. I'll start with our statistics, which this is our new fiscal year numbers. Excuse me. And it's the numbers are low. We started September 1st with these numbers, and due to no activity right now with this program going on, so we haven't issued any new contestant application licenses. We've only issued 4 licenses for judges. We've issued 1 new license for a manager. There have been no new or renewals for matchmakers. no new or renewals for promoters. We've issued 2 renewals for referees. We've issued 16 renewals for the seconds. We've had no new or renewals for event coordinators, and we've had 1 new license for an amateur combative sports association. This concludes my report. If you have any questions, I'll be glad to answer them for you.
Thank you very much. Are there any questions at this time? If there are no questions, let's move to the next issue, which is committee service. We'll call on Ms. Nugent.
Starting video. Just one second. There we go. All right. Good morning, advisory board members. My name is Tuan Nguyen. I'm the manager for this program here in customer service. So just a brief introduction about what we do. So here in customer service, we handle phone calls and email contacts from the public and also licensees. And as you can see in our staff reports, we don't report a lot of the emails because a lot of the combative sports emails are actually routed straight to our regulatory program management team. And of course, if there's any escalations or any license status inquiries, we usually will send those forward to the other divisions. And if there's something that can't be resolved in our division, we reach out to other divisions for that as well. As you can see in our stats that, let's see here, we had some peak stats during January, February. As usual, that's pretty normal. And of course, the increase in July. A lot of our customers are actually asking about how to find forms on the website and also license status inquiries when they call. Other than that, I'll be happy to answer any questions you have for me.
It looks like we lost Dr. Lee. Dr. Gonzalez, can you take over the meeting, please?
Okay, can you all hear me?
Yes, sir.
Can you hear me? Okay, let's move on to Enforcement's Division.
Hi, good morning. My name is Aaron Heath, and I'm a prosecutor with the Enforcement Division, here to give the enforcement staff report. First, we're going to start with some personnel updates. On February 15th, Debbie Hawkins was promoted to Legal Assistant Supervisor. Debbie has been with TDLR for 8 years. On March 1st, John Edlock was promoted to Chief Prosecutor. John has been with TDLR for 7 years. On May 1st, Trevor Thielen was promoted to Senior Prosecutor, and Trevor has been with TDLR for 9 years. And then on August 31st, our investigations manager, Greg Dotson, retired after 22 years of service with TDLR. Also on August 31st, our prosecution legal assistant manager, Daryl Kuntz, retired after 18 years of service with TDLR. And again, on August 31st, senior investigator Esmer Arguijo retired after 21 years of service with TDLR. And then on October 1st, Jackie Revilla was promoted to prosecution legal assistant manager, and Jackie has been with TDLR for 18 years now. So congratulations to all of them. Next, we're moving on to the statistics. As you can see here, for combative sports, we had 68 cases opened and 73 cases closed, which means we're reducing our caseload, which is a good thing. The average time to close a case was 267.56 days, and the percentage of cases resolved within 6 months is 46.58%. Percentage of cases resulting in disciplinary action is 45.21%, and we currently have 55 cases pending for the combative sports program. And kind of to bring this all together with these pie charts down here, you may need to see some of the information above too, because we're going to refer back to that. As you can see, only 7% of combative sports cases originate as criminal history cases, which is significantly lower than the TDLR average of 27%. Criminal history cases, on average, take less time to complete than other types of cases. So without a higher percentage of criminal history cases to weigh down the average time to close combative sports cases will skew somewhat upward. Likewise, as you can tell from above, Over 45% of the combative sports cases result in disciplinary action, which is significantly higher than the TDLR average of 13.48%. Cases that result in disciplinary action take longer due to the due process protections afforded to respondents, which include multiple minimum time requirements before TDLR can take certain actions against respondents. And this statistic also causes combative sports cases average to be somewhat elevated compared to the TDLR average. And scrolling down to our case outcomes. Right there. Yes, there we go. So the case outcomes, sorry, I'm going to start with that section next. We had 0 commission orders, which means that no one requested a hearing after receiving a notice of alleged violation. We had 18 default orders, which means that 18 respondents didn't respond to our notice of alleged violations and we defaulted them. We had 15 agreed orders, which means that respondents communicated with us after the notice of alleged violation and entered into a settlement agreement with TDLR. For fiscal year 2020, we assessed just over $46,000 in penalties, and so far we have collected just over $9,000 of those penalties. We revoked 3 licenses for disciplinary violations. We also suspended 1 license. No licenses were denied or revoked due to respondents' criminal histories. 0 orders were issued. We had 40 cases that were informally resolved, and informally resolved includes cases where there was insufficient evidence, the complainant and respondent informally settled the matter between themselves, or we issued a warning letter for the case. And then negotiated restitution, we had $649 for combative sports in this fiscal year. Sorry, 2020 fiscal year. And then going back up to the alleged violations at opening. Thank you. We had, obviously, our biggest case driver are drugs and alcohol testing for contestants. We had 33 of those alleged violations to open cases. And then we had somewhat less common ones. We had 5 criminal history cases, and then 4 for promoters not having contestants licensed at least 72 hours before an event. And then we're going to go down to the violations that, excuse me, the violations that resulted in disciplinary action. We had 27 cases for drug and alcohol testing, and then we had less common were promoters for failed financial responsibility, and then any kind of licensee for failing to comply with an order. And then even less common cases, we had, let's see, these were promoters acting without a license, and then a contestant not fulfilling a contract. But those are generally atypical types of cases that we receive. Moving on to some case highlights. We picked 5 representative cases of the general caseload that we usually see here at TDLR. And so the first case is Strike League, and on October 1st, 2019 and February 10th, 2020, 2 different default orders were issued against Strike League that assessed a total administrative penalty of $7,000 and total restitution of $6,047 to be collected against the promoter's bond. The department cited Strike League for 2 violations for failure to bear all financial responsibility for an event. Specifically, what happened in this one is the promoter did not pay the venue to rent it out and did not pay the ambulance and EMTs for the event. Then the next case, we have TMB and PRB Entertainment. It's another promoter. On April 21st, 2020, TMB and PRB Entertainment entered into an agreed order and was assessed an administrative penalty of $375. They were cited for failing to assure that all contestants scheduled to participate were licensed at least 72 hours before the event. They did get their contestant license before the event, but you have to do it at least 3 days before. The next case is Jonathan Armand Taylor, who is a contestant, or was a contestant, August 19, 2020. Jonathan Armand Taylor received a default order that assessed an administrative penalty of $4,000. And this respondent was cited for 2 violations for a positive drug test for stimulants, 2 separate stimulants. The next case is Ramiro Garcia Jr., and this individual had both a contestant and a second license. The violation was against the contestant license. So on November 15th, 2019, Ramiro Garcia Jr. received a default order that revoked his contestant and second licenses and assessed an administrative penalty of $2,500. Respondent was cited for a positive drug test for a cannabinoid and failure to comply with a previous default order of the executive director. And then the last case we're highlighting for you today is another contestant. This is Jason Righteous Norwood. On June 24th, 2020, an agreed order was entered against the respondent that assessed an administrative penalty of $250. Jason Righteous Norwood failed to inform the department of the usage of a prescribed or over-the-counter medication at least 24 hours before the event he competed in. And that concludes my report. Are there any questions?
Thank you very much, Aaron. If there are no questions, we will move on to number 4 under item G, and that's Greg Alvarez.
Okay, thank you.
Good morning, board and staff members. I'm doing the report on the Regulatory Program Management Division, the Combative Sports section. And just let me go ahead and start off with the personal updates. Combative Sports, we still got the 8 Combative Sports event specialists, the same one, me, Jim, my assistant, Gus, Arturo, Linda, Joseph, Caesar, and Tony. We're still all working, staying busy. We're glad to be getting back to work, and we'll talk about that here in a little bit. But since our last report, we have hired 2 additional deputy executive directors. Right now, it was Brian Francis, our executive director. Micah Mendez is our deputy executive director. And David Gonzalez and Christina Kaiser both came on board as 2 additional deputy executive directors. Now, RPM is directly under Christina Kaiser. Christina Kaiser, before this, was the director of enforcement, and she got promoted to deputy executive director, and now she oversees our program, which is Combative Sports, which is underneath the branch of the RPM. Now, David Gonzalez, who was our director, got promoted to deputy executive director, and he's over customer service and other programs as well. As we go on, here's the stats from last year's, from September 1st of 18 through August 31st of 19, and then where we're set at this year from September 1st of 19 to August 31st. If you're going to see the big drop, it's because we stopped our shows back in March. We almost had to start up in July, but the spikes were real high, so we went ahead and shut it down again. But if you notice, the amateur MMA, which is usually tied in with a professional MMA most of the time, it dropped from 42 to 15. That's minus 27 events there. In professional boxing, it went from 83 to 25. That's minus 58. That was the biggest hit, was boxing, 58 events that were lost. In professional MMA, it went from 36 to 13. And if you look at the beginning of the year, that's when you got you're coming off, the beginning of the year, you're coming off Thanksgiving, Christmas. So that's usually the slow time of the year anyway. So up to then, that's why, and then in March, when they died down, our busy time of the years, from March basically until now, and that's where we lost most of the majority of our fights. On Muay Thai, we had 2 events last year, and this year 0 because it never did get kicked off. Now there was a couple of MMA shows that were put on one Muay Thai bout on there, but we didn't count it as an event. We just counted it as an MMA event. Promoters meetings. Last year we had 16 new promoters come on. So far this year, we've only had 4. I got 2 or 3 in the works right now, but they want to wait till we're full blown working again because they don't want to invest that money until they know that they're going to be able to conduct business. We had some promoters who got their license last year, but never even conducted one event because of the lockdown. They were planning to have it in the summertime, their shows in the summertime, and that really threw them for a loop. And since then, a lot of them, their license has expired, and we don't know if they're going to reapply. They haven't made up their mind, and we keep in constant contact with them. So we want to get them back because we want to get back to where we're at, even get better. We've had 2 amateur promoters last year, as well as this year. We've had 2, and these just recently, the past couple of months, have came on board, and they're waiting also to get started to do shows also once they see everything's going. But it's going to be a little bit harder for the amateurs to do it because there's really no on the fighters, on the testing. Their gates are a little bit smaller than what a pro card would be, and because all the testing that's involved, all the financials are involved, amateurs probably not going to be taken off unless it's tied in with amateur shows, such as Garcia Promotions. This early coming up here in December is going to be amateur and professional MMA fights going to be happening. Current projects that we've been working during this pandemic is we've been assisting other programs because we've done our protocols, we've done what we had to do with the program. They'll get it online, they'll sort of like going hibernation, getting ready for it to start up. But then down to a lull period. And at that time, we started assisting other programs within the agency. We helped licensing out with the cosmetics, cosmetology program. We helped them process licenses. Some of the staff members were helping them process licenses. And even in electricians, I was even doing them. We're doing electrician journeyman licenses. And then after that, we started helping RPM because RPM, the Architecture Barriers program, was behind on doing approving inspections. So we've been helping them out, and they really appreciate what we're doing. It really helped them because they had got such a backlog, and the personnel they had. We just were able to get caught up, get these projects approved, get their certificates sent out, and just this is other parts of the Texas economy that we're helping out just by doing that. Now we're reeling everybody back in, seeing combat is starting back up. So everybody's having to do their research with the promoters, making their phone calls, make sure the right licenses are taken up. But now we're getting a lot of questions as far as the protocols. And I want to thank Jim, my assistant, Jim Erickson. He's done a wonderful job. He's spearheaded this guy. If it wasn't for him, I don't know, we'd be having to do a lot more work, but he makes it so easy just because he's so knowledgeable as far as what he's doing, working with the work groups, working with the general counsel, setting up meetings with the entire staff where we put in our input, and he's able to put it on paper to pass it along. So I want to thank Jim. I want to thank all the guys in the department because everybody does their own little part. Gus does the federal IDs, works with some of the licensing. Tony, one of the new members, he's working on new training for new inspectors once the contract inspectors start using them again. And he's also doing the cross training with staff members because we're not using contractors when we do the shows. Now we're starting up again. We're using TDLR staff. Other divisions are letting us use some of their volunteers who want to volunteer to help us. So Tony and Joseph have put in a training program to teach them, what we do in the back room, how to address hand wrapping, how to address questions that might arise. And this is going to be a big test. The first show we have is a mega event. It's a big fight there in San Antonio. And it's going to be a big test, because we're using a lot of new people, but our staff, all 8 of us, are going to be there to be able to supervise, help them, assist them. So future shows come up, we're already going to have these people trained in. They can help us out, move along until we open up completely, and we're going to bring contractors back in. Okay. Right now in Texas, the events have opened up. Our first show was October 31st, and the thing with the governor's plan, they're going to allow up to 50% occupancy. Now, that doesn't mean just because it's 50%, everybody can stake 50%. If there's a story today in the San Antonio Express News talking about the Alamo Dome, he said the way the social distancing work, they couldn't get 50% in there, but they're going to have, like 18, 20,000 seats sold out of a possible 50,000. So a lot of things that's going to determine where you can do a show. Like right now, the hot spots are Laredo, the Valley, and Victoria. So if somebody wants to do an event there, more likely it would not get approved until the numbers are improved. And once they improve, then we'll look to see what the infection rate is and decide whether we're going to go in there or not. Make sure we got enough personnel to go there. And right now, another thing that our staff is doing, I forgot to mention, is that on the current projects is Jim has spearheaded this also with the help of the other staff members, is they're doing ongoing training with judges, referees in both sports, boxing and MMA. There's referees, there are people from all around the United States. They join in. They was doing it weekly, but now it's like every 3 weeks. And we're keeping a list of who's doing it. That way, when the shows do come up, we don't have people who've been sitting 7, 8 months not doing those shows. They're staying fresh up on their skills. They're judging fights that already happened and they discuss them. Well, hey, how'd you see it? How'd you see it? So our experience level, I feel confident in who we're assigning to these events because I know they're still doing their continuous education, if what we've been doing with them. So I jumped around. Sorry, guys. I get a little bit excited when I read my papers. And then, let me see. Lee Parham, our deputy RPM manager, is going to talk on the safety protocols here in a little bit. Let me go to the outreach. Outreach is taking place March 7th. And then Combative Sports staff has been participating. Okay, here's the part I was talking about. They've been participating in virtual conferences such as MMA, boxing, scoring with TDR staff and other combative sports officials, along with other state athletic commissions. And really, it's like California's spearheading that, but we're in California, and everybody's been helpful. And a lot of times, the staff also on down times, they'll call licensees. How are you doing? Just check on their well-being. And we've been having a good communication with our general public, our licensees, and such. And after this, Jim's going to talk on the work groups, and I don't know when Lee's going to step in and talk about the overview of the COVID protocols. Any questions?
Thank you so much, Greg. And I really appreciate your enthusiasm, and we're all excited about getting started up again. And our next item is...
I got a question.
Yeah. Excuse me. Go ahead.
Hey, Greg, thanks. When you said the positivity rates, I was wondering if there was a number threshold that can, like 5% positivity in that area, or is there an actual number that stays there?
I think anything above 2%.
Anything above 2% positivity?
Yes. That's when
in that county?
That's when the concern starts rising. If it's below 2%, it's usually okay. But once it starts going above 2%, that's when they start looking at how serious and where it's going to.
So that's a number that promoters could look to local news to find out, how risky their event is coming up.
Yes, sir.
Of being canceled. All right. Thank you.
Any other questions? Let's move on to number 5, Executive Office. Mike?
Hey, Dr. Lee.
Yes,
Mr.
sir.
Chairman, this is Lee. This is Lee Parham. I'm going to go ahead and give the, man, I'm reverbing somewhere.
Lee, this is Mary Winston, TDLR. You are echoing. I don't know why. Can you, we'll check on your microphone. Can you hold off on giving that report until agenda item H? Is that good with you?
Well, only if I have to.
The deputy in charge says you have to.
Oh, okay, Mike, I will. Okay.
Sorry about that, Dr. Lee.
No problem. We're on item 5, Executive Office. Mike?
Morning, Dr. Lee. Morning, everyone. Thanks for having me here. My name is Mike Harris Mendes, Deputy Executive Director for the Texas Department of Licensing and Regulation. Some of those questions that you had that we'll be able to discuss under the work group reports. So we'll make sure we talk about those percentages, everything that you asked about, Mr. Underwood, and Lee will be able to kind of give his report also under the medical health. So I'm going to move on into the executive report. There's been a lot going on, I can tell you that. As was mentioned earlier, since the last meeting that we had back in September, we have added 2 new deputy executive directors. We have Christina Kaiser, who was the former director of enforcement, is now the deputy executive director over enforcement, RPM, and also field inspecting. We also have deputy executive director David Gonzalez, who was the former director of RPM, the regulatory program management, is now over licensing, E&E, or education examination, and also customer service. I am now responsible for overlooking the financial and also IT, along with our disaster response. So along that same line, I want to kind of talk about some things that have been going on. Most of you know that we have a strategic plan that we normally go through, and I'm going to kind of talk about the COVID towards the end in case there's some more questions in that have to do with the October 31 date also. But so let me move on to the strategic plan. Normally, we would kind of take this show on the road and we would go to various cities to get our strategic plan, get some questions answered. We would ask questions to our licensees. But COVID and this whole scenario that we're in right now kind of changed things for us. So we ended up having to move this to a virtual strategic response kind of town hall meeting that we had with our licensees. We still had a very good show of people coming on board and providing us input into our strat plan. So through that, we developed the strat plan in this COVID-19 situation. Ironically enough, the last time that we did strat plan was during the Hurricane Harvey that took place. So we seem to be kind of hitting strat plans when we're having some type of pandemic or disaster that we're responding to. But through that, it helps us to be able to develop how we're going to develop our strat plan and how we're going to submit that in to the legislature. So some of the things that we did do in our strat plan, we have some agency goals. One of them was to fully implement and administer recommendations resulting from our sunset review. In our agenda, Deputy Executive Director Christina Kaiser will talk about our sunset and kind of bring you up to date and let you know about that. But there were some management actions that were brought forward by the sunset staff. So we're in the process of fully implementing those. Another thing that we're looking at our agency goals for the strat plan is to remove redundancies and eliminating bottlenecks within our process to kind of improve, streamline rules, decrease regulatory burdens, but whatever we can do to ensure that licensees are getting the licenses faster, quicker, and so that they can get to work. We're also focusing on protecting our health and safety, which includes combating human trafficking and preventing any type of consumer harm. We received a legislative appropriation and are part now of our anti-trafficking unit. We added staff in order to help us in that endeavor. And so we do have one, which Mary Winston who's on here, is heading up that group. And they've had a lot of great response. They're about to get going pretty rapidly, and then COVID hit. But they're still doing a lot of research and still working, so they're getting heavily involved in it. What the other thing we want to do is position our agency to respond to the next disaster, pandemic, or crisis that could hit. One thing that we've learned is through Hurricane Harvey and now COVID is that we need to be mobile and nimble and be ready to respond for our licensees whenever things like this happen. And so, of course, we'll continue to streamline and improve administration of any program that transferred over to us, which would include, out of the last session, we had motor fuels and motorcycle ATV safety. Those 2 programs are transferred over to us, and so we want to make sure we continue to bring those online with us. I'll move on now to our legislative appropriations request. The LAR has been submitted to the Legislative Budget Board and the Governor's Office. A lot of you know that we were requested And all agencies were requested to have a 5% decrease in our budget, which we did. We submitted that in to the LBB and the governor's office. The LAR instructions that came out prior to submitting our LAR also asked for us to keep the 5%. So the appropriations request that we submitted for the next biennium of fiscal year 22-23 includes a 5% budget reduction. So we had to implement that into our processes to ensure that we were meeting the criteria and the requests that were asked to us by the legislature. I'm going to do the communication stats real quick, and then I'll turn it over to Christina Kaiser before I go into our COVID-19 response. In our communication stats, over the past 6 months from April until October 15th, the Combative Sports website has had 15,696 views. That's actually a pretty large amount of views. You can see an average of about 85 a day. You can see that 31% of those have access through a desktop, 68 through a smartphone, 1% through a tablet. Here are the top reasons that they're visiting the website. One is for forms and publications. The second one is for administrative rules. The third one are for frequently asked questions. The fourth are results of previous events. And then the fifth one are the Texas State boxing champions that we have. So at this point in time, I'm going to turn it over to our Deputy Executive Director, Christina Kaiser, who's going to give you an update on our Sunset Commission report and be able to answer any questions that you have on that sunset.
Thank you, Mike. Good afternoon, Dr. Lee and advisory board members. I am Christina Kaiser. I am one of the deputy executive directors here at TDLR, as Mike and Greg mentioned to you today. You are probably aware that TDLR is under review currently by the Sunset Commission of Texas. The Sunset Commission is an actual agency of the state of Texas that's made up of senators and representatives and public members. And their job is to review all of the agencies that exist in the state on a periodic basis to determine if those agencies are still relevant and if they're still adding value for the citizens of Texas. So TDLR's review began in September of last year. And Sunset staff came over to TDLR and had, I don't know how many meetings, 50, 60, maybe 80 meetings with large and small groups of TDLR staff. And they really immersed themselves in our world. They rolled their sleeves up and dug in to really learn in detail about our processes, about our policies and priorities, to learn how we do things and to identify any areas of concern that they could see. So at the end of their review, agency, they published a staff report, the Sunset Staff Report. And this contained the staff's findings and recommendations about TDLR. That was published on June 4th. And if you have not had a chance to look at that, you are able to access that on the Texas Sunset Commission's website. So most notably in issue 1 of the Sunset Staff Report, the staff have recommended that TDLR continue in existence. So that's good, right? That's step 1. So as you look through the report, you will see that it is divided into issues, and there are 7 issues. Each one is stating a broad category of findings about the agency. And then under each issue, there are recommendations, and there are 2 kinds of recommendations there. Some of them are recommendations for statute changes, and then some of them are recommendations for management actions. And these are things that the agency can do on its own initiative at any time without waiting for a statute to be changed. So it's important to understand that the staff report is not the end of the process. It's actually the beginning of the process. What happens next is that the Sunset Commission will hold a public hearing that has not yet been scheduled for TDLR. They are starting to hold public hearings for some of the other agencies that have been under review in this current cycle. The last we heard, we anticipate TDLR's public hearing will happen between now and January, but we don't know anything more specific than that. So the first step is a public hearing where the agency representatives come before the Sunset Commission and speak about the report and answer any questions. And there may be an opportunity for public comment. That is yet to be determined as well. In some of the hearings that Sunset has been holding recently, they have not had public commenters actually invited to the meeting. So we'll see how that plays out for TDLR. Following the public hearing by the Sunset Commission, there's then a second hearing that's called the decision hearing. And this is where the Sunset Commission, that body of senators, representatives, and public members, will actually vote on the recommendations contained in the staff report. And they can adopt them, they can reject them, they can modify them if they want to. After that process still isn't over, what happens next is if the Sunset Commission agrees with some of the recommendations for statute changes, then a bill will be created and filed in the next legislative session, which is set to begin in January. And that bill then has to make its way through the legislative session and pass for those statute changes to become effective. And then when that happens, then the agency will go about the business of implementing those statutory changes. In the meantime, however, remember I said there were two types of recommendations. The other, besides the statute changes, the other one is management action recommendations. And we have actually already been getting about the business of making some of those recommended changes in the management actions category. For the most part, we felt like they were good recommendations and they would benefit us and put us in a better place in terms of being able to serve the state of Texas and the concerns of our regulated population. So we've been moving on apace with some of those. And I can tell you that no matter what happens in the legislative session, no matter which changes pass or don't pass or get adopted by Sunset or not, our overall feeling is this has been a good process for us, and TDLR is going to be a better agency at the end of this because we have learned so much already just through the interaction with the Sunset staff. And so we're looking upon this as a very positive experience. I'm going to stop with that, and I'm happy to answer any questions if you have them.
I guess I have one, and nice to meet you, Ms. Kaiser. I think this is the first time. Thank you for this. I did pull up on my tablet here real quick, Sunset. That is very interesting. Did they happen to have anything interesting for combative sports? I noticed that it was a lot of different agencies. So was there anything on the combative sports side that caught your attention or would catch our attention before we had time to read this?
So there were no specific no specific recommendations about the combative sports program. So there was nothing that TDLR, you need to do this, or the statute needs to be changed thusly. However, there was some mention of the combative sports program in issue 6 of the Sunset staff report. And if you pull up the report and take a look at it, it would be on page 79 of the report. And in issue 6, the Sunset Commission is recommending that TDLR take a more risk-based approach to its regulatory efforts. And that includes enforcement, that includes inspections, and that includes the activities of the Regulatory Program Management Division, including, running these combative sports events. And so there was a mention about combative sports in that context. And essentially what Sunset said was, I've got it pulled up here. Let me just, it says TDLR's approach to inspections in the combative sports program does not align with known risk. And kind of their point is that we staff and we conduct our functions sort of similarly across all events, no matter how big or how small they are. I think the most salient language is the agency recognizes risks vary widely across events and promoters, but staff does not collect or analyze the necessary data to quantify these risks and tailor the agency's level of on-site involvement accordingly. So this was an observation made by Sunset staff based on having attended an event during the process of their review of the agency. And so I would say this is a soft recommendation that maybe there is some data that we can evaluate in a more systematic way and maybe better document some of the decisions we make about the staffing levels that we send to events. It's certainly nothing that's earth shattering. Mike, if there was anything you wanted to add, please jump in.
Yeah, thanks, Christine. That is correct. There was what Christina Kaiser mentioned was kind of going all the way across all of our programs. I can tell you that one of the things that was recommended, and again, this is a part of a sunset recommendation, they did identify what they called unnecessary duplication of licenses, which were the matchmaker license. They also identified the event coordinators and seconds as a possible dereg. Again, this is a recommendation by Sunset staff. So they did identify those and said that they kind of overlap in some instances with the promoter license. So, we'll see where that goes from there, but they did identify those 3 particular ones in their report also.
Thank you so much, Mike. I totally blanked on that part.
I have a quick question on that, Carrie Hatley again. And it just one of the few things I was actually kind of skimming over that. So I guess overlapping on license, what did you mean that they are second guessing whether the seconds need to have a license?
That's correct. They have brought up that that particular license may need to be reviewed for possible dereg to not have the seconds licensed. I think that we would still probably look at having some type of certification, something that would still be able to apply to everybody's in that corner, because I don't think we want to exclude that. But they did, in a formal fashion, kind of discuss that the seconds could be under the manager, just a member of the team. So that's a part of what they talked about in their report.
Yeah, I think that would be something we want to keep control of. Just my opinion. I think the seconds, as an official dealing with the seconds, if we cut that license out, then we're saying it's how do you control that? That would be the only one that caught my ear on that. I do understand overlapping, and if you're a manager and you have a manager's license, you should be allowed the second. I'm hoping that's what they're recommending, and I will read this report. It's very interesting. What I skimmed over, it looks like they did. I'll grab or I'll brag on our staff. I think our guys do an extremely good job at large events as well as small events. And I'd like to read that and might have questions in the next meeting, but yeah, the seconds license caught me off guard. I think you'd have to, in my personal opinion and personal experience, that would be required for a second. How do you even control that? If I guess would be my question. But anyway, I'll read the report. Thank you guys so much, and that was very interesting.
You bet.
And Mr. Hatley, if I can just sort of pinpoint for you, the part that Mike pointed out about recommendations about eliminating licenses, it begins on page 31 of the Sunset Staff Report under issue 2. And there are actually 3 license types that they're stating are duplicative and unnecessary to protect the public. It was matchmaker, event coordinator, and second. And their recommendation is simply that licensing should not be needed for these actions. They're not recommending that you don't need those actions as part of a combative sports event. So there could still be seconds. There could still be people who are called seconds and do everything that a second does right now. It's just that under this recommendation, they don't think they need to be licensed. But again, that's something that would need to go through the full legislative process. And one other thing I'll mention, you still have an opportunity to affect the outcome of this whole process. You are welcome to go to the Sunset Commission's website and offer written comments about anything in the report that you have concerns about. And so, that's what this process is about. It's not just about, a handful of Sunset staff. It's about taking in the input of all of the regulated industry. So I urge you to take advantage of that if you have some concerns.
Okay, thank you very much. That is interesting, and that just caught my ear of controlling that corner people. But yeah, definitely I'll go read that, and then I'm glad you give us that, and at least we don't have to go through the whole thing. We can kind of pinpoint us there. But thank you so much.
Thank you.
And along with what Christina Kaiser had mentioned, I would encourage everyone, if they would like to go and make a comment on our on the sunset report, feel free to do so. We encourage that, as we've told all the other advisory board members with the different advisory boards that we've had, is to make a comment. But the only caution I would give you is to make a comment as an individual and not as a board member for the advisory board, which would be the only caveat that I would put on that, is to ensure that that's what's going on. So being no other questions, Dr. Lee, if you don't mind, I'll go ahead and finish up with our COVID response. And I apologize. I know this is a long report. There's just been a lot happening, and it's what happens when we don't see you guys for a year. We want to kind of bring you up to date. It's kind of like family. Is we want to sit down and let's talk about all the things that have happened in the last year. In our COVID response, when the declaration was made, we went home back in March. We currently have quite a few of our staff working from home. I can tell you that we did have some staff that continue to work from the office because of the nature of what their job responsibilities were. Our IT division did a great job of getting people set up. As you can imagine, when you're at work and doing your work there, and then all of a sudden you leave there to have to do your work at the house, well, there's a lot of IT issues that take place. And so our IT division kind of worked through that, got our employees up and running, and imagine that of having approximately close to 500 employees and trying to figure out all their IT issues and IT needs, and they managed to get that done. So we want to give our hats off to our IT services. Some of the things that we did, though, in this process is that the continuing education requirements for some of our licenses were waived. This was for the requirements of CEs that were to be in March, April, and May and June. We waived those and extended them. We had some late renewal fees through June 15th. On June the 10th, we did resume inspections and investigations on a very limited basis. We're beginning to increase that more and more. Along the same line as the question that was asked by Mr. Underwood is, how are we looking from the number standpoint? As you know, the governor put out that 15% hospitalization rate was kind of what they were looking at for the counties, and that at the 15%, they had to go back to 50% occupancy and 50% on some of the restaurants. Those below 15% could go up to 75% occupancy and open up some of the businesses. What we have done, that we have taken some of the counties that were above 15%, and we're not doing any inspections or investigations in that on a very limited basis. So we're kind of along the same line of 15% as well. I can tell you this, is that there are a lot of numbers that are out there. We look at the 7-day positivity rate. Even in that, there's a specimen collection date, there's a lab test report date, there's a case report date. All those percentages are different. Although they're maybe 1% or less than a percent apart, they're all different. And so it's a matter of which one you're following. Lately, we've been following the hospitalization rates for 15% and kind of been tasking a lot of what we're doing based on that coming out of the governor's office. So that has been going on also. I can tell you this, is that we have been working closely with the governor's office and some of our licensees to ensure that they continue to have the ability to work, to reopen, and but more than anything else, to reopen safely, that there is no consumer harm being done to the public. So we want to make sure that they're protected. We want to make sure that the public's protected, and then also our inspectors, when they go out, that they're protected. As you know, as was mentioned earlier, we have our first event, combative sports event in San Antonio, October the 31st. It is going to be without any pun to what's going on right now, but the eyes will definitely be on Texas on that day. This will be the first national event with spectators since COVID hit. We've had events taking place, but nothing of this magnitude. So I can tell you that our combative sports team, GC with Doug Jennings, and also Jessica Escobar, who's kind of a backup, along with Brian, myself, Christina Kaiser. We have been working diligently to ensure that we have all safety protocols in place to ensure that we're going to have a safe event. Working with the promoter, as was mentioned earlier, the promoter has been working also to ensure there's compliance with that. What we know is that we control the technical zone and all that area in the back, and those are the places that we're ensuring that it's going to be safe. And making sure that we're administering proper protocols, social distancing, face coverings to be worn while in the technical zone at all times. So there's all these precautionary measures that we put in place, the testing way ahead of time to make sure. So it has been quite an event for us to go through, but we know that if done correctly and done the way we know that Texas can do it, we will set the precedence for other states to be able to take a look at us to see how they want to open. And so this is going to be huge on our part, but we know that we're up to the challenge and up for the task. And we're looking forward to a great and successful event on October 31st in San Antonio. I'm available to answer any questions at this time.
If there are no questions, before we move to the work group, did we want to have Lee do his presentation, or do you want to stick to the agenda?
Sir, on
I
a
think we can.
particular, we've had a request to have a 5-minute break if possible.
But in answer to your question, Dr. Lee, we could probably put Lee's presentation within the work group for the health, the medical.
Okay, you want to do a 5-minute break? Okay, let's have a 5-minute break and we'll meet back in 12:40, 41 rather. Thank you. meeting, and I think we're on item H, and that's Jim, you're up.
Good afternoon, board members and other meeting attendees. Jim Erickson, Combative Sports Program Assistant Manager. I'll give you some reports from the work groups today. First one we're going to start out with. First of all, can you hear me okay? Okay, thank you.
Yes.
First one we'll start out with is the rules work group report. The current work group members are Dr. Wayne Lee, Blaine Seville Sr., Keith Underwood, and Kerry Hatley. The rules work group's main topics of discussion included the existing Muay Thai rules.
Oh, looks like I got hooked up. Never mind. Sorry. Bye-bye. I got hooked up. Sorry.
Okay. The rules work group's main topic of discussion included the existing Muay Thai rules.
Okay. Bye.
As well as a set of rules submitted on behalf of the United States Muay Thai Federation, also known as USMF, updating the current kickboxing rules, and the comparison of bare knuckle rules with the current TDLR combative sports rules. The sport of Muay Thai was accepted as a provisional sport by the Olympic Committee, the International Olympic Committee in 2016. This means the governing body of Muay Thai receives $25,000 annually to work on their application to become a fully recognized Olympic sport, which could take up to 7 years. Olympic sports such as boxing have international governing bodies, and in the United States, boxing has a national governing body called the NGB. The NGB is required by the Ted Stevens Sports Act and is the only organization that can officially develop a team to represent the United States in the Olympics. The NGB, through tournaments and tryouts, submits a team roster to the United States Olympic Committee, the USOC, who then submits the team roster to the International Olympic Committee. I use the sport of boxing as an example because it is the only amateur combative sport not regulated by TDLR's combative sports program. None of the other amateur combative sports programs regulated by TDLR's combative sports program have an officially recognized NGB. And again, the national governing body has to be recognized by the U.S. Olympic Committee before a team chosen by that body can be advanced on to the International Olympic Committee headquarters. The major, that kind of covers the Muay Thai part of it. The major difference between TDLR's current rules and the rules submitted on behalf of the USMF is the age requirement. Currently, contestants under the age of 17 years old are not allowed to compete in amateur Muay Thai in Texas. The issue raised with this situations are twofold. The first issue involves qualifying tournaments for national and international team competition. In Texas, if a contestant is under the age of 17, they cannot legally compete to get full contact bout experience. Other states allow younger competitors to gain experience and improve their skills by allowing them to compete in full contact bouts, which puts Texas competitors at a disadvantage when traveling out of state to participate in a tournament. The second issue is the illegal events held in Texas to give these younger competitors experience. The illegal events often do not have proper medical protection in the form of doctors, emergency personnel, or an ambulance for the competitors. An administrative rule change would have to take place to allow younger competitors. The work group will confer and get input from the medical health and safety work group to weigh in on the dangers, if any exist, of allowing competition between athletes under the age of 17. And that's the gist of the Muay Thai part. I'll move next on to kickboxing. After discussion of the Association of Boxing Commission's Unified Rules for Kickboxing, the work group would like to further its research and recommend at a later date the adopting of these kickboxing rules in Texas, as the Texas are somewhat aged and have unique rules that don't apply in a lot of other states. So it would be better for the competitors coming to Texas with more of a common rule set. We'll work with the GC, General Counsel, Doug and Jess on proposed rule change in the future. Future rule changes are also being discussed regarding unified rules for mixed martial arts. This year, one of the major rule changes by vote of the Association of Boxing Commissions 2017, the definition of a downed opponent is reverting to the original 3 points of contact. And that's what Texas had stuck with the whole time. It was originally 3 points of contact. A vote was held. It went to 4 points, and it just wasn't going over very well, so they reverted back to the 3 point stand. Other minor changes would bring Texas in line with the ABC unified rules. Final item discussed by the work group was bare knuckle boxing. The work group did a side-by-side comparison with the rules used by the Kansas Athletic Commission, which were submitted to us by one of the bare knuckle boxing promoters. The work group will complete a memo with questions for the medical health and safety work group in order to gather their feedback on the bare knuckle boxing. So that concludes the report for the Rules Committee. I'll go on next to the Medical Health and Safety Work Group report. Current members are Dr. Wayne Lee, Dr. Manuel Gonzalez, and Dr. Richard Schramm. The Medical Health and Safety Work Group has reviewed COVID-19 information with input from work group members, state and tribal athletic commissions, promoters, ringside physicians, and other medical professionals. The work group's goal mirrors the Texas Department of Licensing and Regulations goal of developing and continually updating event procedures to mitigate COVID-19 exposure and transmission among licensees, event participants, staff, and the general public. The TDLR Combative Sports Program staff met on several occasions and created a rough draft of a step-by-step process covering event approval, planning, and execution. The process was then shared with the Combative Sports Advisory Board's Medical Health and Safety Work Group for their review, update, and approval. As the pandemic evolved, adjustments were made to the procedures, which currently is in its 4th revision. As I had written this, it's now the 6th revision, so we are continually upgrading and improving the process. Some of the key items included, and I'm not going to touch on much here because Lee is going to go over it. Submittal of an operational plan by the promoter to address social distancing, protective equipment, COVID-19 testing and screening, and cleaning and disinfecting of lodging and competition areas. Specific guidelines for hotel check-in, weigh-in ceremony, as well as venue check-in for staff, participants, and officials. And finally, tracking and daily recording of temperatures and health status of event participants via health history questionnaire. Work group member Dr. Richard Schramm also conducted a fact-finding session on a concussion-based method of baselining using the reaction of an individual's eyes to various light movements. Dr. Schramm has done a lot of study and has given some input on that, and it's something that we would like him to bring up at a work group meeting at some time or another. We can investigate that further. So that is, again, the Medical Health and Safety Work Group report.
Could I raise a question?
Dr. Schramm.
Yeah, I brought up at the work group meeting whether or not we should submit this event procedures protocol to the Texas Department of State Health Services, and I'd like to bring that up for discussion now.
I would defer to Dr. Lee if this is appropriate time for that.
I think we need to, it can be brought up, but let you finish the report, and then we can bring it up and then see if it meets the guidelines in terms of what needs to be done for forwarding a document to the state.
Well, it's my understanding we're required to do so.
Okay, can I get a comment from legal?
Mr. Chairman, can I come in here? Okay.
Yes.
So when a promoter initially submits a event request, whatever the date is, they're required to send it to the Department of State Health Services, as well as us. Okay. So before we ever start the approval process, we make sure, TDLR makes sure that that particular request has been sent to DSHS, okay? DSHS doesn't do anything with it, to tell you the truth. It's more of a, okay, it's here, we've acknowledged it's here, TDLR, you kind of take the ball. So, I mean, that's kind of how the way it's progressed throughout this COVID business.
And if I may, this is Doug Jennings, Assistant General Counsel. Thank you, Lee. Just to clarify, is in our plan and our protocols, which we'll be discussing in a moment, we will be going over that. You know, there are a number of categories. We have a promoter who is interested in holding an event has to submit a plan to us that goes into pretty great detail. And we believe we're covering all the bases. And so not only will we be privy to that plan, but DSHS as well. And so we haven't gotten a lot of guidance on all of the aspects of a plan. So we have really developed our own internal protocol that we think is more than sufficient. So, but yes, they'll be submitting that to DSHS, copying it to DSHS when submitting it to us. Yes.
My point is that we're dealing with the TDLR Event Procedures Protocol. That's a document. And we fall under a category of professional sports leagues, according to the governor's strike force. And if you go to the minimum standard health protocols, the first line for the professional sports leagues is each professional sports league that desires to reopen must first submit a plan to the Texas Department of State Health Services. And this event procedures protocol, from my perspective, falls under that category. And I believe we should submit the event procedures protocol to the Department of, to the Health Department. And I need someone's guidance on that. And if it's legal, it's legal. But my understanding is, based on the governor's strike force, that we are required to submit this TDLR event procedures protocol to the Department of State Health Services.
Mary Winston, TDLR. Thank you, Dr. Schramm, and thank you for referencing the strike force report and where we can look into this and make sure we are following those protocols. Doug, in our general counsel's office, let's look into this and make sure we're doing everything we're supposed to do. We are in contact. We want to make sure that we're following proper procedures. So after this meeting, we will reach back out to you. We'll send an email and let the board know where we are with this, if we are proceeding properly or if there's something else we need to do. But we'll do a deeper dive to make sure that we are presenting as we should. Doug, I don't want to put other stuff on your plate, but this is important. Are you good with
Absolutely.
that?
Absolutely.
Okay.
We'll take care of it. Thank you.
Doug, just to clarify, if you go to the Governor's Strike Force to Open Texas website and you scroll down, as posted July 3rd, 2020, there are a list of categories. And under that list, or under that subheading, you'll find professional sports leagues. And if you hit professional sports leagues on that website, then you will see minimum standard health protocols, checklist for professional sports leagues. And the first sentence says each professional sports league that desires to reopen must first submit a plan. So again, my question is, the event procedures protocol is a very complex protocol. It involves lots of testing. It involves a bubble that's going to protect the public. And there's a significant risk that that bubble gets burst and a lot of people can get infected. And I want to make sure that we're covering all of our bases. And if we need to send this protocol to the department, then I want to make sure we do that properly.
Dr. Schramm, we absolutely will. I'll be in contact with DSHS today. And if, you know, one of the questions is whether we are contemplated as a sort of entity that needs to submit that to them. I don't see why it would hurt whatsoever. I agree with you that they should probably be privy to what other state agencies are doing. So we will look into that this afternoon and get back to you as soon as we can. Yes, Mike, sorry.
Great. Thank you.
Dr. Schramm, this is Mike Ersman, as Deputy Executive Director. I can tell you that when these safety protocols were all released for the various entities, and if you go out to the governor's website and look at the strike force, there are a numerous amount of protocols for each individual entity or the various industries that exist in the state of Texas. We had discussions with the governor's office, and through those discussions, we kind of ascertained that the professional sports leagues were in, whenever the documents first came out, if you go back and look at the governor's executive orders, pertain primarily to the NFL, Major League Baseball, the NBA, those type of professional leagues, and was not encompassing combative sports, boxing, MMA. And the reason for that was that there was not a kind of a league that existed through that. So, but we still took the procedure and the protocols to ensure that we were still going to follow and watch these professional leagues to ensure that we were meeting those safety protocols. We will do everything we can with DSHS to ensure that they have the information that they need to from our protocols. The document states that the league were to submit that to DSHS. Another document that we're following in this whole procedures is the one that was released on October the 23rd, I believe is when it is. I'm sorry, October 13th, that talked about event organizers. And so we're following that document as well as event organizers to ensure that we're meeting the safety protocols. We're still ensuring that if it's an indoor event, that they cannot go over 50%. The event that we're having in October, it's going to be at 25% because they're not able to meet the 50% requirements and have a safe distancing allowed. So the promoter has taken on that responsibility of just doing 12,000 people in the event. I think they said they're capping it at 1,000 individuals or spectators. So it is based on the event as well that we're trying to follow and ensuring that the promoter has submitted that document. I had a discussion with some staff over at DSHS myself that basically stated send it to the DSHS website and the email, I'm sorry, not website, to an email, which they did. And we received documentation that it was submitted to DSHS. And it's pretty much correct that was stated. They're accepting that information. What they're doing with it, we don't know, but we're getting verification that they did submit to that. And then we, on top of that, are putting our own protocols to ensure safety of the events also.
Thank you for that. I just want to clarify, I don't claim to be an expert in public health, and I don't know that anyone else on the advisory board is an expert in public health. The Texas Department of Licensing and Regulation provides oversight to professional combative sports organizations. And from my understanding, in that instance, we need some coverage from the DSHS. Just to clarify that, Doug. Thank you.
Thank you.
Okay, any other discussion on the medical health and safety work group? Now we'll move on to the drug testing protocol work group report. Current members are Dr. Manuel Gonzalez and Dr. Richard Schramm. During the last year, our board has been kind of whittled away. We had the passing of our friend Chris Reed. We had a new appointment with Mr. Garcia, and now we have a new appointment with Dr. Chapa, as well as Maurice Watkins. So in transition, since work groups kind of got skinny down and we didn't have a lot of participants that were available, and we were scheduling conflicts. If one of the participants wasn't available or didn't respond to the request, we kind of put it off a couple times. And so as a result, this drug testing work group did not meet. The work group looks forward to meeting with the inclusion of new work group members. So we'll we'll further our work with the drug testing protocol work group at that time. The enforcement work group report. The current work group members are Carrie Hatley, Keith Underwood. The enforcement work group discussed items that they would like to see improved and possibly resolved. Among the items discussed were the current and future actions that can be taken to address a breach of contract between a contestant and a promoter, the development of a documented procedure for dealing with reports of illegal combative sports events hosted by either licensed or unlicensed promoters, and clarifying what can be done to address reports of instances of an individual piggybacking on another promoter's license, for example, renting out a promoter's license for a person that cannot or does not choose to get a proper promoter's license. They're still being involved heavily in some of the promotion of events. Both enforcement prosecutor Aaron Heath and Assistant General Counsel Doug Jennings have agreed to assist the work group with clarifying information and working towards solutions for the above mentioned items. Work group's goals include ensuring that both parties involved in contract disputes are treated equitably through the due process procedures. Like to see the limiting or eliminating of dangerous illegal combative sports events, as well as ensuring that all individuals hosting combative sports events are properly licensed. The work group is looking forward to continued dialogue with and guidance from TDLR enforcement and general counsel. This concludes the enforcement work group report, as well as the other three reports. If there's any questions, I would entertain them now. If not, we can move on. Thank you so much.
Any questions? Can we move to Lee?
Okay, all right. Thank you, Mr. Chairman. It's great to see everyone, and I mean, it's been a while. I want to thank everyone for their hard work on all these issues, and I want to welcome Eric Garcia, Dr. Chapa, and Maurice Watkins to the board. Maurice is not participating today, but I want to welcome everybody to the board. I want to let y'all know that, you know, how we got to where we are with the COVID protocols that we're going to implement on October 31 in San Antonio, and also to partially answer Mr. Underwood's question concerning the positivity rate. There's no magic number to it. We're going to take each city, location, and site on a case-by-case basis when it comes to approving events. So I wanted to let Mr. Underwood know that. Moving forward, we've decided, like Greg mentioned earlier, not to use contract inspectors during COVID. We are using TDLR staff members from other divisions, which a lot of them have actually worked in combative sports or helped, let me back up, have helped us with the combative sports events over the years. So it's not like a new person being thrown in there. I mean, we're utilizing folks within the agency that know about combative sports and how we administer those events. Also, I want to thank all those people. You know, I want to thank all of those volunteers for coming in and helping the program out. I mean, it's, you know, it's gutsy to volunteer to help with the combative sports event with the COVID and everything else that's going on. And to let y'all know, the board and everyone else, to start off, all TDLR staff, ring officials, and ringside physicians will be tested, rapid tested the day of, okay, the day of an event, meaning October 31 of this month, And then every event that we have approved so far, you all will be tested, rapid tested the day of. Now, TDLR staff members will also be tested earlier in the week, 3 or 4 days earlier in the week, which means that'll be next week. First part of next week, our staff will be tested for COVID, as well as, the day of the rapid testing. So I just wanted to let everybody know that. I want to thank, there's a ton of people to thank on this. Our goal on this is to develop and continually update these event procedures to mitigate COVID exposure. We started this process out in really early April. COVID hit sort of in March. So we've started this process out in early April, and we've kind of worked through it during the summer. If you all remember, we said, okay, we're going to restart events. Well, we had to put that on hold due to positivity rates and the spikes in COVID. Now, these protocols that we've come up with, they're not meant to, take the place of health and safety guidance provided by federal, state, or local governments, or to override the advice provided to a person by their healthcare provider. It depends on the person. In these protocols, we define event personnel, okay, as promoter staff, contestants, managers of contestants seconds, all referees, judges, timekeepers, ringside physicians, and emergency medical personnel. And also, excuse me, media representatives that are granted access to the tech zone or the fighting area. Because as we all know, there's media folks within the technical zone. When a promoter submits a plan, they must provide details about how and when event personnel will be tested for COVID. Also, COVID screening, promoter's plan must describe how the promoter will provide daily COVID symptom screening for event personnel isolated at the host hotel. Using current terminology, we're talking about the hotel bubble, how it's set up, including the promoter's COVID screening protocols. We're also addressing the event bubble and how the promoter is going to, screen and provide the most safe way of putting on the event. So this is a major. It's been a major undertaking for us because now I'm not going to say it's been a stop start. However, we've been working on this for months upon end. And once when you think you have something figured out, something else pops up. It's just the nature of the beast when it comes to combative sports. And the folks I want to thank on putting this together, and you all have been provided a copy of this COVID protocol. I don't want to read it to you verbatim. You can kind of work through it, but the work of our Combative Sports Advisory Board, medical health safety groups, Dr. Lee, Dr. Gonzalez, Dr. Schramm, and as well as we had some non-board physicians and ringside physicians that we utilized. Roger Temple and, well, Dr. Chapa, you're now on the board now, but we utilized you also. we also gleaned information from Scott Smith, which is our testing vendor with Austin Mobile Drug Testing, regarding the types of tests, the costs. Jim Erickson has been heading up all of these work group all these work group meetings, as well as kind of, he took the banner and charged forward with putting this protocol together. Him and Doug Jennings, our general counsel representative. Jim has also spoken with Dr. Don Musi, who is the Association of Ringside Physicians president. He also has received information from Top Rank, UFC, California Athletic Commission, Arizona Athletic Commission, Nevada Athletic Commission, and the ABC, which is Association of Boxing Commissions. And Jim also sat in on a teleconference meeting with the California Commission and got input from their lead physician, Dr. Paul Wallace. I don't know, Dr. Wallace, you all may, but California has held a few events prior, in the past, prior to us doing this kickstart. And I think they are, California and Nevada are a good kind of a reference to help us succeed as we're kicking this off. And I mean, as most everybody knows, it's a little bit nerve-wracking starting up events again in this COVID era here in Texas. But I've got all the confidence in the world that, the program staff, as well as, ringside physicians, judges, referees, everybody will make this a success come October 31. So with that said, I'll take any questions, and I've got Jim online if y'all have any specific COVID protocol questions. I just really want to thank everybody for the input, and the help that you all have provided for us.
This is Keith Underwood, promoter. I have a question.
Yeah.
So I don't know where the echo's coming from, but so if you, as a promoter, I want to be able to calculate my risk of an event being canceled. And in your thing that you were just showing on screen, it just says it can be canceled at any time before bout event, before the first fight. So if there's no concrete numbers, if as a promoter you can't look at positivity rates or hospitalization rates and know that there's a threshold when things are going to get canceled, so that I can maybe mitigate some of my loss by canceling early, or there's so many things that factor in. There's so much money that's laid out before the event.
Sure.
It would be helpful if that threshold was defined.
I hear you. I understand what you're saying. And we have kicked this around a lot, over the past few months. We need to get a couple under our belt, Keith, is what I'm saying, and try to figure out, we're going to be successful. And yeah, we're talking about a mega event coming October 31. But I mean, even coming on down mid-range shows, as well as club shows, we're going to have to figure it out kind of as we go along. And as we go along, we're going to be able to provide you and other promoters better answers to the questions the questions you're asking, because I mean, we've heard all these questions, and I can't tell you right now, okay, here's the positivity rate where we say, okay, that's it. Nope, not going to do it. Okay. We're going to try our best, believe me. just because we're with the government, you can trust us. We're going to try our best to say, okay, it may be 2 weeks before. Okay, Keith, maybe we ought not do this. You know what I'm saying? We've got some escalating positivity rates or whatever. So we're going to try our best to actually help the promoters not to lose money. Now then, with that said, there's going to be some promoters that lose money. Okay, that's happened in the past. So that's about the only thing I can tell you right now. Anybody else?
Any other comments? I think all the comments have been heard. I think this is a dynamic document. We haven't had anything like this, so I understand everyone's concern, and I guess the only way we can really get all this done is to hear everyone's opinion, and even once hearing that, we still have to make adjustments. So we'll see how this goes and move forward and take all comments as always. Let's move to item I. Anna?
I'm sorry, Mr. Presiding Officer, did you want to have new assignments for the work groups? We do have some vacancies.
We have, let's go back to that. In terms of the vacancies in the work groups, the members on the work groups, does everyone have a listing seeing which work groups are vacant?
I can give y'all the list here. We have for the rules work group, we have Lee, Sybil, Hatley, and Underwood. For the medical health and safety work group, we have Gonzalez, Lee, and Schramm. There is a vacant position for this one. For the drug testing protocols work group, we have Schramm, Gonzalez, and Hatley with one vacant position. And for the enforcement work group, we have Underwood and Hatley with two vacant positions.
With the vacant positions and with the addition of the two new members, do you see any work groups that you two may be interested in participating in? And also, people who are currently on work groups, do you wish to increase your workload by going on to additional work groups?
I'd like to bring up a comment. My son he's been out of fellowship for a year and a half, and he's a sports medicine fellow that came out of University of Pittsburgh. Trained, well, he was affiliated and treated the Panthers for head injuries, drug testing, as well as the Steelers. So he was involved with all these things. He's very knowledgeable of combative sports. Be an asset to either one of these groups, both the drug aspect of this and the concussion aspect of this. I think he would bring a lot to the table.
So, Mary Winston, TDLR, Dr. Gonzalez, thank you so much. And we do have many times, as staff was stating earlier, that we do, Jim was talking about folks that we brought in who weren't actually members of the board to consult with. And so that is wonderful. That's a wonderful sort of thing for us to know of who we can reach out to, because Dr. Chapa, apparently we reached out to him and now he's on the board. So we'll take that in consideration, definitely. For the work groups that we are mentioning now, those are just limited to the board members. Anna, can you give me that first work group and who's in it and how many openings?
So the first work group we have is the rules work group. That doesn't have any vacancies, but I do have that Mr. Hatley is in 3 work groups. If he was willing to go down to 2, most of the members have membership in 2 work groups. Blaine Sybil is in 1. He is in the rules work group.
Okay.
And we have Eric Garcia, Maurice Watkins, and Dr. Chapa who need a work group.
Okay, so which work group, which is the first one, begging your pardon, Dr. Lee, that actually needs a new participant?
Sure, we have the Medical Health and Safety Work Group with Dr. Gonzalez, Dr. Lee, and Dr. Schramm, and that one needs one person.
I can jump on that one
Dr.
Dr.
Chapa?
Chapa?
Awesome.
if that's okay with everybody.
It's better to volunteer than be voluntold. Thank you, Dr. Chapa.
Dr. Lee, is that okay with you?
That's perfectly fine.
Okay. The next vacancy we have is the Drug Testing Protocols Work Group with Dr. Schramm, Dr. Gonzalez, and Mr. Hatley, with one vacant position.
Dr. Lee, you may have to volunteer somebody. I don't see any volunteers.
You want me on that one too, or?
Is Dr. Chapa volunteering to knock those two out right now?
Yeah, I can get on those. I can get on.
Luis, you want to get on that one?
And the last work group we have is the Enforcement Work Group. This has Underwood and Hatley listed with two vacancies. Mr. Watkins and Mr. Garcia are not on work groups if you'd like to appoint them to this work group.
They're going to get on the work group by default.
Thank you, Mr. Garcia, and we will let Mr. Watkins know. Thank you, Dr. Lee.
Okay. Moving on. J, recommendations for agenda for the next, oh, I'm sorry, I skipped item I. Item I?
Yes, thank you, Dr. Lee. Again, this is Doug Jennings, Assistant General Counsel for the department. If you look at your agenda, it's written a little bit differently than what we will actually try to do today. Our goal was to have a draft rule proposed for the board to evaluate today, but it didn't quite get finalized. And so what I'd like to ask you to do is, Dr. Lee, is to refer this matter to the rules work group. I'll just give you a little background. Some TDLR staff, particularly RPM, has been looking at statutes and rules in Nevada, California, and New York dealing with best practices and codes of conduct for ring officials. So that would include judges, referees, timekeepers, and ringside physicians. And the goal would just to create a rule that gives clear guidance to our ring officials about what type of activities are prohibited, what types of activities are required. So, for example, we want to instruct ring officials that they are to avoid conflicts of interest and avoid appearances of impropriety, and give them some exact guidelines, like you may not have a direct or indirect financial interest in any contestant, don't accept a gift, don't give a gift or accept a gift from any contestant or any other licensee. Obviously, don't place a wager on any combative sports event. Things like that that directly influence the way the program is viewed by the public. We want to make sure that all TDLR regulated events are above reproach, that there's no question about the neutrality of any of our ring officials. And so this would just be developing some rule text in the work group, then bringing it back to the work group at the next meeting, perhaps for approval by the board for publication. So I'd just like to ask Dr. Lee if you would refer that to the rules group, we would appreciate it.
This is basically rules and it should go under the rules group. So let's assign it to the rules group, and when they have their next meeting, we'll all get copies of that, and then we can move forward from there to have it ready for the next meeting for discussion. Okay, any questions as far as item I? Let's go to item J. Do any of the members have any recommendations for items to be discussed in the next and upcoming meeting? Do we need to put?
Dr. Lee?
Yes, go ahead.
I'd like to add the enforcement work group has been working on protocol for all the things that Jim just explained that we discussed. I'd like to bring that up in an actual board meeting for some sort of decisions on those issues.
Okay.
In the future.
if you guys are ready from the work group to have your document presented forward, then what we will do is have the document presented, and then at the next meeting, it will then be able to be presented for a vote. But it has to go through is that correct, Mary?
Yes. So, Dr. Lee, and thank you, Mr. Underwood. You do it under a work group report. And so someone from your group, you or some other volunteer, would give us the findings of the work group and we would proceed from there. So we can definitely take that as a suggested agenda item for the next meeting. And if you all are ready to report, we can do it at that time. And then following that report, if not at this, even at the same meeting, it's possible that we could discuss for action, but we'll have to get that report first. And so that's a good suggestion. We also will have probably a report from the rules group um, concerning the I, agenda item I. So those are two different items that we would have in the next meeting. And as always, as agenda items arise, Mr. Underwood, anyone who's on this board, if you have something that comes up, contact us at advisory.boards and we can get that item added for you. So, but thank you, Mr. Underwood, because that would be a work group report from that enforcement work group. And it looks like the rules work group has some work to do as well.
Okay. Going back to the public comment, is it protocol that we give a response to the person that submitted their public comment from the group? That's to Mary.
If that is an item that you want to bring before the group, then we do have that public comment from Mr. Corley, and we can bring that for further discussion in a meeting moving forward. That's something that I think we'll have to look into because I'm not in enforcement anymore, so I don't work these cases. And General Counsel will look at the possibility of being able to do that, those requests related to Muay Thai and how our rules and statutes would allow us to participate in that way. So is that going to be a rules work group item to meet on, Doug?
Yes, Mary, believe so. Believe
Okay.
that group is looking at that item.
So that is another item that we can put on for future agenda.
So going back to the public comment, so from the committee, do we send them a letter saying that it has been sent to the work group? And then
Oh, no, sir.
further, we don't send any letter to them?
This is on YouTube in perpetuity. I don't know how long this stays or leaves, but we will get notice. I'm sure he's watching the meeting, Mr. Corley. And when we notice the next meeting, we would have this as an agenda item. And that it would be how he would know. But he's been in contact based on his communication today with different staff members and so forth. So we don't send a letter directly to anyone, but we've kind of notified the public that this is going to be discussed in the future.
Okay. If there are no other further items, let's move to my comments. Let's move to item K.
Real quick, Dr. Lee, sorry, Kerry Hadley. Jim, I think we're real close on several of ours. Don't you agree? On our rules and I think, and Mary, to answer your question, I think we can be ready. We got several time, and I know me and Keith and Jim have talked several times, so I think it's time to move forward with that. So we could take the burden on and get it done.
Looking forward to it. Thank you.
Along that same line, and since we've been meeting so long, such a great gap between meetings and with COVID, I would like to at least put out to the group trying to get a meeting date sooner than later. So that goes under item K in terms of a date and time for the next meeting. With the holidays and everything coming up, I am putting out as a suggestion the month of January, and like to get an opinion from the group in terms of what do they think about that month.
I think mid-January would be good.
Richard?
Underwood agrees.
Okay. Richard, what do you say? You're on mute.
Yeah, I'll check my calendar. I usually take
Okay.
a lot of time off in January.
Okay. All right. So what we'll do is we'll get with Anna and you'll put out some dates and then we'll get it voted on by the group and then we'll send a formal notification out based on that. Is that correct?
Yes, sir, that's correct.
All right.
Dr. Lee,
There are no other, I'm sorry?
Dr. Lee, you may have already covered
Yes,
this, but okay, that's right. You know, that's right at the beginning of legislative session. I may be getting in here on the tail end, but that's the beginning of legislative session. So that's probably a good time to meet.
Thank you.
All right. And if we at least can get some of the items in terms of how it applies to combative sports, then that would help us to have a stronger meeting when we do meet in January. Okay. With that being said, let's move to item I, which is adjournment. And the adjournment time is at 1:39. I'd like to thank everyone. I'm sorry for my late coming and my internet snafus. I wish everyone to be safe and with the holidays and everything moving forward and for the guys coming up with the event on October 31st. I'll call the meeting to end. Thank you.
Thank you, sir.